She's director of national and international involvement at Parks Victoria in Australia. So probably she's the one who has been traveling so much to come here. So thank you again. He has been working since a long time ago to promote Healthy Parks, Healthy People program, which has been probably the starting point for most of these initiatives all around the world. So we are very honored to have you here. And she is also very active on the Commission on Protected Areas of the IUCN. And she's also the chair of the specialist group on health and well-being of this organization. And we are very pleased to have her here and hear about the context at the international framework and scale.
Thank you.
Please, your floor.
Thank you. Good afternoon, distinguished guests and delegates. I'm quite honoured to be here. I would like to thank Miguel's Foundation and Selvins for inviting me here. So I'm going to summarise where we've come to in terms of health in the context of conservation efforts, where we are now and maybe what's coming up next. So I was asked to put some context around the global state of forests. So this is not my area of expertise, but I have some brilliant colleagues in Australia who've helped me with this information. So the graphic there shows that although the Earth has lost 35% of its pre-agricultural forest cover over the past 3 centuries, forests are still widely distributed and covering about 40 million square kilometres, of the Earth's terrestrial surface. However, the remaining forests, a massive 82% of those forests are now degraded to some extent as a result of direct human action. And as the human footprint continues to expand, the forests that are free of damage or pollution from human footprint is in rapid decline. The recently updated Global Human Footprint, which is a composite index of about 8 human indicators or pressures, is believed to be a good proxy of overall intactness of a forest, found that in 2009, it's 10 years ago, only 18% of forests had no detectable human pressure, and that's a massive 35% decline since 1993. The areas in green show no human footprint, but the areas in blue and purple show low to high levels of human footprint around the world. And in the context of Australia, the country that I come from, this graphic shows the original cover of woodland across the country. And this graphic shows an overlay of the woodland that has been modified or replaced. They're the areas in red and orange. I think these statistics show us demonstrate this is an urgent problem. And what's at stake if we do nothing? Just life itself, I think. So just imagine a life without forests. More than half of the world's population now live in cities. Rapid and ever-increasing urbanisation are creating dense cities. And in the context of human history, this is a relatively new phenomenon. This photo is a typical new housing estate in the outer eastern suburbs of Melbourne in Victoria, Australia. I actually think this image is really scary. And one of the results of our modern lifestyles is, of course, declining health. 2/3, that's 67% of Australians aged 18 years or over are now overweight or obese, and that equals 12.5 million people. And that's a 56% rise since 1995. And obesity can lead to non-communicable diseases such as cardiovascular disease and diabetes, and all of those diseases are preventable. In the United Kingdom, the largest public health issue is loneliness. Health is not an outcome, it is a process. So my day job is working for an organisation called Parks Victoria. It's the National Park Management Agency for the state of Victoria in Australia, and we look after protected areas. We call them parks or the bush, but they're essentially forests. And Healthy Parks, Healthy People is our approach to managing those parks. It is based on the concept that our healthy ecosystems support healthy societies, and parks or forests support healthy ecosystems. Parks are important for conserving biodiversity and improving physical, mental, spiritual and social health of people. We work pretty hard every day at Parks Victoria to protect and enhance the biodiversity and conservation values of our parks and forests. But we also have a very clear role to play in providing broader societal benefits. And those benefits that are traditionally not associated with park managers. So I'd like you to stop and think, just for a moment. Think about one of your fondest memories from your childhood when you were a very small child. Does it by any chance include nature? Playing, swimming, fishing, camping, making mud pies. Nature provides the essential services that are a pillar for life on our planet, including human life. And in our modern society, parks are a key part of our contact with nature. If a connection to nature is formed in childhood, it is highly, highly likely to stay with you for the rest of your life. So quoting a very famous professor in Australia, Professor Tim Flannery, he says it's absolutely unavoidable that healthy parks, healthy people and a healthy planet go together. You cannot have one without the other. So in order to better realise the benefits that nature provides, it requires a top-down and bottom-up approach, a simultaneous approach across sectors. And by that I mean working at a global level to influence policy and programs with organisations such as the World Health Organization, the Convention on Biological Diversity and the International Union for Conservation of Nature, while at the same time working with local communities and like-minded partners to deliver meaningful health-focused programs for people in nature. And forests are the best kind of nature. It is fair to say that the conservation sector, and in particular NGOs and park management agencies, have taken the lead with regards to the health benefits of nature. And many organisations across the world are working to develop integrated policy, deliver programs and build partnerships and continue to build the evidence and advocate for nature. We all get this. There's no argument. We have agreement. We have the research and the evidence, and we have the policy and programs. And despite the fact that we'll always need more, the time to act is now. I'll briefly outline some examples of programs internationally, one of which is started by the IUCN. Nature provides many solutions to global challenges. They have an initiative called Nature-Based Solutions, and it was introduced in 2013 in their global program and builds on existing principles and frameworks such as the CBD's Ecosystem Services approach, and has particular relevance for the Sustainable Development Goals. It is also a very strong component of the 2015 Paris Agreement. And over the last decade, there have been some significant international events that have helped shape the health and nature agenda, and events just like this one. that drive partnerships and build legacies that live beyond the event itself. And I'd just like to highlight a few. In 2014, Parks Victoria and the US National Park Service, along with many, many other partners, including Europark Federation, delivered one of 8 streams at the World Parks Congress. It is an event that is only held every 10 years, and it sets the agenda for park and protected area management for the following decade. And the overall recommendation from Stream 3, which was on improving health and wellbeing, was to unlock the value of parks for our health and wellbeing while conserving biodiversity. And National Geographic reported that the link between health and nature was in the top 5 of take-home messages from that 5-day event that included 6,000 or 7,000 people. And there was a very controversial statement that was made by a medical doctor, Dr. Jonathan Patz. He said, "As a medical doctor and public health scientist, it is in my professional opinion that conservation biologists can actually save more lives and prevent more illness than the health sector." A few years later, the IUCN initiated a program, a hashtag called Nature for All. And at the very core, the idea is simple. The more people that experience, connect with and share their love of nature, the more support there will be for conservation. In 2016, at the IUCN World Conservation Congress, there was the passing of Resolution 64, which specifically called on the IUCN and the WHO to work together to strengthen cross-sector partnerships, to recognise the contributions to nature, to health, wellbeing and quality of life. This work was led by Parks Victoria, but supported widely by organisations in Canada, Korea, Scotland, Finland, New Zealand and many, many more. This was really significant because for a 70-year-old organisation like the IUCN, deeply embedded in traditional conservation, they made a very bold statement to recognise the health benefits of nature. And following on from this, at the COP13 meeting in Cancun in Mexico, the Convention on Biological Diversity further developed initiatives and recommendations to link biodiversity and human health. In fact, it was a key focus of that COP13 meeting. And there is also a motion going forward at the next World Conservation Congress in 8 months' time in Marseille, in France, and we hope to have similar success. A direct outcome of Resolution 64 was the creation of the Health and Wellbeing Specialist Group, which I'm lucky enough to chair, which is still only after a few years getting started. But it is a core outcome, a group of specialists that's continuing to grow to help mainstream the idea that health and nature are inextricably linked. Then in 2017, to further activate what the IUCN and the WHO promised, we brought them together for the first time, the IUCN President and his equivalent within the World Health Organization, to hold a World Leadership Dialogue titled Nature is Good Medicine within the context of the 15th World Congress on Public Health. It was an event of many firsts. It was the first time that Healthy Parks, Healthy People had been delivered in the context of a health event rather than a conservation event. And it was also the first time that a biodiversity strategy was released in the context of a public health event. And at that same event, which was held in Melbourne in the state of Victoria, our Environment Minister and our Health Minister jointly released what is called the Victorian Memorandum for Health and Nature. And essentially it pledges the government to work in collaboration across the health and environment portfolios to deliver better health and environmental outcomes for its people. And this translated directly into $80 million worth of funding. So there is now very strong policy recognition within the state of Victoria within our biodiversity strategy and our public health and wellbeing plan that nature and health are linked. It's important to say that policy is policy, and in some ways, two ministers pledging to work together is a bit of a no-brainer, but it is important because they're our figureheads, they're politicians that hold power, and for them to publicly state that that is the direction of the government is important. And then I came across this quote. I don't know if any of you have seen it, but I only came across it really recently, and I'll just quickly read it out. Dr. Gus Speth, who is an environmental lawyer, he's retired now but was an advisor to Bill Clinton and the CEO of the United Nations Development Programme, says, "I used to think that the top environmental problems were biodiversity loss, ecosystem collapse and climate change, and I thought that with 30 years of good science we could address some of those problems. But I was wrong. The top environmental problems are selfishness, greed and apathy, and to deal with those we need a spiritual and cultural transformation, and we scientists don't know how to do that." But do we? In Australia, our Aboriginal people, our traditional custodians of the land, have a saying: if you care for country, country cares for you. The health and well-being of benefits derived from nature is not a new idea. Australian Aboriginal people and Indigenous people around the world have known this for thousands of years, and it's a powerful message and reminds us that we are reliant on nature and land for our existence, for our body, mind and soul. It also reinforces for us the benefits of nature and the need for us to conserve and protect it, as we are all part of a natural world. And as a community of practitioners in this room, which is truly inspiring to be a part of, how can we contribute to a broader understanding and acceptance of caring for country and caring for forests? There are a number of challenges that we have facing us. There are very few rewards or incentives for organisations and people to work across their sector. We still work predominantly in silos. We use unfamiliar language. Sometimes it's difficult to demonstrate the tangible benefits, particularly to the environment. And we need to transition to non-traditional partnership models and funding. But there are many opportunities. We need leadership. We need champions and drivers. We need partnerships that recognise each other's strengths. We do need to rethink our funding models to grow the program. We need to better understand what the current role of government is to enable, support and lead versus what is the role of non-government organisations and business, which may be to innovate, to drive and fund. We are thinking about and discussing these issues all the time, and we need to better coordinate ourselves. But I believe there is such power in this room. Let's try and harness it. Thank you.
Thank you.